Hi, my name is Jennifer Haley, and this is Community Health Assessment. Demographics as of July 1st, 2018 in Rosendale, which is within the city of Boston. It is part of the Suffolk community. There's a total population of 674,913 people residing in the Suffolk County. There's a total of 31,524 in Rosendale. Population households is 30,965 and population of families is 24,268. The diversity index is 80%. This is the diversity index, which is the scale of 0 to 100 that represents the likelihood that two persons chosen at random from the same area belong to different race or ethnic groups. Total housing units is 12,715. Owner-occupied units is 6,368. Renter-occupied units is 5,629. Vacant housing units is 718. The median home value is 409,531. Average home value is 436,024. The median household income is 72,127. The below poverty level is 4,307. The above poverty level is 30,436. Total households 13,769. The average size of the household is 2. Average family size is 3. Households with children is 4,194. Households without children is 9,575. The male versus female population. The male population is 45.73% and the female population is 54.27%. Here you see the median age is 37.8. Citizens born in the U.S. is 24,878. Not born in the U.S. is 7,542, and people that are not citizens is 3,525. This is the occupational employment in Rosendale. Government workers is 3,072. Nonprofit companies is 4,137. Self-employed is 1,568. And then there's the blue collar, which is 2,294. And white collar is 17,891. Education statistics. Those without high school education is 1,249. Those with some high school education is 8,473. Those with associate's degree is 1,536. Bachelor's degree is 6,708. And graduate degrees is 5,639. Marital status in Rosendale. Married is 12,376. Never married, 12,983. Widowed and divorced and separated. What means of transportation are frequently used in Rosendale? Well, there are 12,185 cars that are registered in Rosendale. A lot of people commute by commuter rail or bus. And then there's a lot of bicyclists in the area. We do have a lot of bike lanes that were recently made on the roads for safety of bicyclists. Nearby hospitals and healthcare centers, we have the Greater Rosendale Medical and Dental Center, which is in Rosendale Village, and it was established in 1975. It is a nonprofit community health center serving residents from local communities like Rosendale, West Roxbury, Hyde Park. and it's affiliated with Boston Medical Center. They provide services such as pediatric, adult, and family medicine, as well as dentistry, OB, GYN, nutrition, podiatry, social services, and family planning. And then our nearest emergency department is the Faulkner Hospital. It is also a part of Partners Healthcare, and it's affiliated with Brigham and Women's Hospital. The Faulkner provides a large range of services for mental health, addiction services, medicine, and surgical procedures. Local aid and services for those in need. We do have a Rosendale local WIC office located in the Rosendale Village. We also have the local Social Security office, and we have Southside Head Start, which provides affordable daycare and childcare. It's a part of the Head Start program. Issues that impact our community and others is the HIV epidemic. HIV is on the rise again, and just recently there were seven kids under the age of 17 in my community that were diagnosed with HIV. Every month, 1,000 young Americans become infected with HIV. Ages 13 to 24 make up about 26% of all new diagnoses of HIV. Most young people diagnosed with HIV today contracted the disease through sex. A little more than 60% of Black and Latino youth ages 15 to 24 are affected by the disease, and 32% of white young people are affected as well. The problem is they're not being tested. So the CDC has now recommended that young people be tested regularly for HIV, especially if they're sexually active. They also now suggest when anyone goes in for a physical, they ask if you want an HIV test, which is something that I never heard of before, but they're doing it now just because of the epidemic. IV drug use is another problem we face as a community. Opioids are a problem that every community in the U.S. is affected by. We lose so many people each day to heroin and fentanyl overdoses. HIV and hepatitis are transferred by IV drug use. IV exchange programs have been developed to reduce the transmission of HIV. There are many pharmacies. You can go to CVS and they have an exchange IV needle exchange program. There are drug addiction centers all over the U.S. There's Learn to Cope, which is a program that's all over Massachusetts, and they talk about the opiate addiction, and it's basically for families of loved ones who have the addiction, and it helps them cope and learn of resources to get their loved ones help. If you have a PPO or HMO, you're able to have your treatment covered by insurance. But if you have Mass Health, you can only get treatment in Massachusetts. A lot of good addiction centers are outside of Massachusetts. There's one in California, there's one in Texas, Florida, and they're drug treatment centers. And they usually provide a lot longer treatment than programs in Massachusetts. Most programs in Massachusetts, they want to kick you out after 30 days. Addiction is a horrible disease. If a person is ready for treatment, they have to ask for help in order to receive it. Most programs will not admit you unless you go through the emergency room, and if you have an opiate, or if you have alcohol in your system, then you have a better chance of them getting you into a program, getting you a bed, and getting you treatment right away. I've had an experience with my family. I have a brother who's a heroin addict, and he was a heroin addict for over 7 years. He's been in and out of addiction centers all over the U.S. Before he was 26, because he was covered under my parents' health insurance, so they were able to get him good treatments out of state. When he turned 26 or 27, I think that's when he got Mass Health, and then programs were just local programs, and he went through the same thing of being kicked out after 30 days, and it was just an ongoing process. He had a horrible experience his last time he overdosed. He felt like he was out of his body, looking over himself, dead, and he was like saw something, and he was able to Narcan himself, and he snapped out of it for a couple of minutes, was able to dial 911 and passed back out. By the time the EMS got there, he was out, and they were able to Narcan him again several times and got him to the emergency department. He knew from that time that he didn't want to die, and he was scared, and it was something like he never seen before. And he actually asked for help, and the emergency room was really great, and they were able to get him a sponsor that came right in and got him a bed into a program, and helped him on his way to get him sober. And that's when he found out about the Vivitrol, and he's been once a month he goes for the Vivitrol shot, and it curbs his cravings for the opiates, and he's been clean for over a year, and he's doing great now, and it's just amazing what this opiate blocker actually does. It saves lives, and it's actually proven to be effective. So research has been done lately about this Vivitrol. Blocker that it blocks the receptors in the brain, and just recently, 2 weeks ago, my brother's been going through a clinic, and they asked him if he'd be interested in being interviewed by the Boston Globe about his experience and how the Vivitrol shot has been working for him. And they wanted him to tell his story so that other people will see that it actually does work. So yeah, it's pretty amazing that they have this, that it's been proven to work for people. Yeah, so my paper is pretty much about the opiate addiction, HIV, and affordable healthcare, because all of it relates. In order to get that help, you need good healthcare. And that is something that, we need to work more on, so that, people are able to afford health insurance and can get the help that they need. They could be tested, for HIV. They could, get the addiction treatment that they need. I mean, if they are HIV positive, then they can afford their antiviral medication. Affordable health care is what it comes down to for everyone, and especially with, addiction and HIV. So hopefully we can come to some kind of better plan for our community to make it a better place. And as a nurse, I like to educate and, teach about sex education, how to, get the treatment that you need for addiction and, public health, affects all that. And all this is to do with public health and taking care of our community that we live in so that people have longer, healthier lives.